Most people think a due date is the day they get to meet their babies, but it really is a compass for their whole pregnancy. Doctors use it to track your baby's growth, to schedule ultrasounds and tests, and to determine when is the best and safest time to deliver your baby. In this video, I'll explain why knowing your estimated due date matters more than you think. Most of the information I'm using was obtained from a committee opinion published by the American College of Obstetrics and Gynecology, which was reaffirmed in 2025. This was done in collaboration with the American Institute of Ultrasound in Medicine and with the Society for Maternal Fetal Medicine. By convention, the estimated due date is 280 days after the first day of the last menstrual period. This is assuming that these are regular monthly cycles where ovulation happens on day 14th after the first day of the menstrual cycle. This does not account for inaccurate recall of the last menstrual period, irregular cycles, or variability in the timing of ovulation. That's why it is important to perform an early ultrasound to corroborate the estimated gestational age. That first ultrasound is very important because it also helps establish a date, establish whether this pregnancy is viable, if you can observe fetal heart tones or not, the location of the pregnancy, whether this pregnancy is inside the womb, inside the uterus as it should be, as opposed to an ectopic pregnancy or a pregnancy of unknown location, and to determine whether it's one or more babies, and even some anatomical variations of the uterus or abnormalities of the uterus. If the pregnancy resulted from artificial reproductive techniques, the artificial reproductive techniques derived date should be used to establish the estimated due date. Now, that ultrasound, that first ultrasound in pregnancy, as I mentioned, it's very important. It allows doctors to time diagnostic testing, interventions. It also allows them to track the baby's growth and to determine when is the safest time to deliver the baby and prevent preterm deliveries, post-term deliveries, and related comorbidities at the time of birth. Investigational studies and statistics. This committee opinion outlines a standardized approach in determining the gestational age and the due date that can be used within and amongst different medical institutions. Conventionally, and to be practical, the due date lands when the pregnancy is dated at 40 weeks of gestational age. And to try and simplify when to make interventions or recommendations, the pregnancy is conventionally divided in 3 trimesters. If we divide 40 weeks into 3, we get approximately 13 and a half weeks. And to round it up, we use about 14 weeks for each trimester. The most accurate ultrasound to confirm or revise the estimated due date would be early in the first trimester. Why? Because all pregnancies start with the same measurements, and then you have other determinants that can affect how fast that baby grows: genetics, nutrition, other medical problems, and later on in the pregnancy you can start noticing more variations in the growth of each baby. A significant difference or discrepancy between what the baby is measuring on ultrasound and how the pregnancy is dated by last menstrual period could affect estimating the due date. As a rule of thumb, we say that if the difference on ultrasound measurements is more than 7 days in the first trimester, that is up until week 13 and with 6 days, then we use the measurement by ultrasound to establish the due date. In the second trimester, we use a difference or discrepancy of 14 days or more. And in the third trimester, we use a difference of or discrepancy of 21 days or more. There are more detailed and specific discrepancies that we use to establish the due date and the gestational age. In conclusion, a pregnancy that does not have an ultrasound examination before 22 weeks and 0 days that confirms or revises the estimated due date is considered a pregnancy that is suboptimally dated and runs the risk of not being accurate in following the infant's growth, the timing of the delivery, the timing of the diagnostic testing, and the interpretation of those tests. So it is very important that pregnant women start their prenatal care early so that we can ensure that we are following and we are tracking and we are ordering tests as they are needed to obtain the best results. A healthy baby, a healthy mom, everyone happy. Thank you. If you're interested in watching more videos, please subscribe, leave me a comment. If you're interested in a particular topic in which you would like me to discuss, please leave me a comment.